we've had the pleasure of having Dr. Stephen Leffler, the Media Medical Center President and COO, with us. Dr. Leffler, welcome back. How have you been?
I've been well, thank you. Good to be back.
Excellent. How? Let's dive right in. We wanted to check in on your sense of the status of the virus in Chittenden County. How's the hospital doing? And any updates on that side is always be helpful. And then we want to talk a little bit about outdoor activity as we start to head into the colder months. So maybe start the updates.
Yeah, so Chittenden County continues to be in good shape in terms of COVID-19. I think our residents are still really overall doing a very good job of doing the right things to keep the virus spread low. Our college students have actually done a really nice job. If you look at the testing happening in our college and our college students, the positivity rate has been consistently less than 1%. So across the state, also our numbers continue to be low. And like early in the summer when we had that outbreak in Winooski and we thought, is that going to be a big deal? We had an outbreak recently in Shoreham, but very quickly our Department of Health was able to isolate those patients, prevent the spread, and not have a wide scale outbreak like we've seen in some other places. So that is really encouraging information that our Department of Health, our healthcare workers, and the people of Vermont are doing a good job and taking this seriously and doing the right things. So everything from a COVID perspective right now in Vermont is good. The bad news is if you look around us, we're surrounded by red counties and red states right now. All around Vermont, there's more and more COVID. And so I do think it's inevitable that we're going to see a little bit more here because people are coming into and out of Vermont, even doing the right things. I think we're going to have some more cases. Right now, today in the hospital at the medical center, we have no one with COVID, no one in our ICU. But we are very full. We have a lot of patients here right now. And so we are still planning every day for whatever comes in this fall and winter with COVID. But as of today, Vermont and the medical center are in quite good shape.
Great. So, and Dr. Leffler, when you say you're full, that's an indication of kind of normalcy of normal operation.
Yes, full with everything else of people who need our care. So we're running at 98% for operations, normal capacity today, and our inpatient census is high.
So last week, we had the universities and colleges, Superintendent Flanagan with us. We talked about how really we kind of celebrated a little bit that the month of September had been this key transition month and that we were through it. And we had seen the levels remain very low and that was a real community success. My sense is we're now entering another transition of sorts, maybe not quite as, surely not as dramatic in terms of an influx of people here coming here, potentially bringing the virus with them that required its own, all these protocols and testing. But the transition that's happening now is really with the weather and with the cooler days and nights and earlier darkness upon us. I think we've gotten to the point on some days where it's no longer as easy and kind of pleasurable to be outside as it was this summer and spring. And I just thought it might be a good opportunity to check in and talk about outdoor activity versus indoor activity. What our current understanding is of the lower risks with the outdoors, and maybe we could speak a little bit about also conversely there are some risks to staying indoors too much, separate from the virus, apart from the virus. So why don't we start with our understanding of the science? The stat I see is it's at least 20 times harder to catch the virus outside than inside. Is that kind of how you think of it, or what's your thoughts on outdoor activity today?
So yeah, I should make you an honorary doctor because that's about the right number. So it's actually quite hard to catch COVID when you're outside walking down a street. Even if you happen to walk quickly by somebody who has COVID, it's pretty hard to catch it in that kind of situation. You have to be together for a little while, usually in an enclosed space where you are really breathing in the COVID virus more than like one breath. You have to be around these people. And so what we know is outdoor activity is quite safe, and indoor activities, especially as you get with more people, more crowded, more together, talking louder, maybe someone's coughing a little bit, markedly increases your risk. And that is really where you start to see the super spreader events, where someone in an enclosed space has COVID. They can infect a lot of people in an hour. Much, much less likely if people are outside. That said, we know for a fact that there's something called seasonal affective disorder. When it starts getting darker, when people stop being outside and getting sunshine and doing all the things outside that make you feel good, people get depressed. Isolation is not good. And we've seen some impact of isolation already from COVID in Vermont. And so there's a balance here. So we need to figure out ways for people to continue to enjoy outdoor activities, to get out, get some exercise, stay healthy. One of the great things about Vermont is we have 4 seasons. So this is your year to take up snowshoeing, winter hiking. I think we're going to have some good opportunities for people to ski and snowboard safely. Our ski areas are working very hard to provide safe opportunities for that this year. So I agree with you. We have to keep our lives going. Exercise is good for us. It's good for our mental health. Being outside in whatever sun we have this time of year makes you feel better and is very low risk for COVID.
I just want to clarify something there. I've had constituents talk to me about this. That scenario you started with of people sort of passing each other outdoors. To say it's very hard to catch COVID in that direct. I mean, my understanding is that kind of transmission just like it doesn't happen. Like that's not that sort of people passing each other on the sidewalk or on the bike path. That's it. You know, that is really not something people should be fearful about. Am I saying that
I
right?
agree with that. Yes. Okay. I mean, what we're learning with COVID is there's nothing about COVID that you can say never or always. You know, yeah. It's a virus and it keeps changing. And so I don't want to tell you the risk is 0 to never, ever happen, but it's very, very unlikely. And I think people should feel very comfortable going for a walk on the bike path or going for a walk before or after work or those kind of things that make you feel good. I think those are good for you and you should continue to do that stuff.
So, how would you think about an event like is happening here this weekend, Dr. Leffler? If you were, you know, I was talking to my dad about this, you know, who's you know, older and is properly pretty conscious about exposure to the virus. You know, we're having a gathering at City Hall Park to open this new park, and you know, we're telling people to wear masks, and we're gonna make sure that speakers are spaced out. How would you think about attending or not attending, you know, an event like that, and what should you be mindful of if you were to, you know, go to one of these events in City Hall Park this weekend?
So first off, people should think about their own medical conditions or their loved ones and make a decision. If you have significant lung disease, significant other health issues that would make catching COVID or any kind of pneumonia very dangerous for you, be really thoughtful and be careful about what you choose to do, just as a general principle. But especially in Vermont right now, where the amount of COVID in the state is still very low, and we are getting good screening data back that shows that the number of COVID cases in Vermont is well under 1% of the population. People should feel pretty comfortable going to events if they're doing smart things and taking good precautions, which you just told me. Socially distance, wear a mask, be thoughtful about keeping your hands clean, be thoughtful about how close you are to others. And then if you get to an event and it doesn't look like that can be done safely, leave. But I think we can feel pretty comfortable right now that we can do things like that safely if we're smart about it. And I would just tell, there are some Vermonters who have to be more cautious and they maybe shouldn't go. But for most of us, I think it's very safe.
Excellent. Well, that, I appreciate the conversation, and thought it was a good week to focus on that with the weather starting to turn. I will say, I see we have with us today some members of the media and others that are kind of frequently join us. The city's thinking a lot about this principle of the outdoors being safe, thinking a lot about how we can ensure that our assets here in Burlington, these wonderful, the bike path, the marketplace, the Intervale, we're really thinking, is there more we can do this winter than in a normal winter to make it as easy as possible for everybody to get out, to make sure that everyone has equipment that they need to be able to enjoy the outdoors. And we want to encourage all of our partners and kind of stakeholders in Burlington to be kind of asking themselves the same question. We'll be coming back in future weeks with some more details and specifics to offer. I see this a little bit like the beginning of the summer with this new reality when the city made a decision we were gonna have summer camps outdoors and encourage when there's a lot of talk and a lot of places were actually closing camps. We went forward and had a full summer programming, had no infections in any of the Burlington summer camps that we're aware of. And I think, we saw many community partners make that same decision. I think we're at kind of a similar decision point here as we head in the winter. Anything that any organization can do to think about the outdoors, how do we make it interesting, fun, to engage in the outdoors. I think that there's the virus health benefits from it, but as we've heard from Dr. Leffler here as well, the physical and mental health benefits of getting out as well. So thank you for helping us kick off this discussion. We'll be back with more in future weeks. Anything else, Dr. Leffler, you want to share with us before we say goodbye?
Yes, the one other thing is if you've ever considered getting a flu vaccine, this is the year. Really important this year to get a flu vaccine for a bunch of reasons. Most importantly, getting a flu vaccine could help prevent you from getting the flu. And if we do have COVID come back, the less flu cases we have in the hospital, the more room we have for COVID patients. If you get a flu vaccine and you don't get sick from the flu, you won't be confused about whether you have COVID or not, so you won't get sick. There's actually even a little bit of data out there that shows that maybe even just getting the flu vaccine and cranking up your immune system a little bit could be good for you if you are unlucky enough to catch COVID. So there's a bunch of good reasons to get a flu vaccine. It's very safe. If you're concerned, please talk to your doctor. But I would argue that if you've ever thought about it and not done it, this is the year, 2020, get your vaccine, please, really important. I got mine this week, and I'm hoping that everybody in Vermont chooses to get a flu vaccine this year.
Excellent. Why do the people think of the flu vaccine? Is it just misunderstanding? I think a lot of people who, are big believers in vaccines would never think of not taking a measles vaccine, a mumps vaccine. Somehow the flu vaccine, people think of in a different category. I think we have uptake rates that are much lower for it. What do you know what explains that? And is there some kind of deep misunderstanding about that people should get over?
First off, I think you get a lot of the other vaccines when you're a little kid. Your parents just take you to the doctor and you get them. And then as you get older, you get to make a decision. So the first thing I want to tell you is that flu vaccine is not live. It's dead, and it cannot make you catch the flu. So some people will say, oh my gosh, I got the flu after I got the vaccine. Just not true. It's a dead vaccine. Now you can feel a little bit sick. That's your immune system responding to the vaccine and ramping up your immune system. So I think that's really important to know. The second important thing is that the flu vaccine is not perfect. It doesn't 100. So every year they make a prediction early in the spring for the coming fall, what strains of flu they think are going to be here in North America and in Vermont. They do their very best to give us a vaccine that matches what they think is going to come. It's not perfect every year. So far, actually, it looks pretty good this year. But so some people who get the vaccine, I want to be clear, a small number could go on and get the flu, but we do know this. If you get the vaccine and you're unlucky enough to go ahead and get the flu, you get it more mildly almost always. Your immune system does help. It does remember enough of it to help you. So I think a lot of people think, oh, the flu's not that big a deal. I'm not that worried about it. I'll take my chances. But for some people, the flu can be a very serious illness. And this year with COVID, if you come down with symptoms of the flu, it's not exact match, but people are going to think you have COVID. You're going to get quarantined. You're going to have to go get testing for COVID. You're going to do a lot of other stuff. So it's a really smart year. Take one of them out of play for sure by getting a flu vaccine, which is very, very, very safe.
All right, excellent. If you're a member of the public, your employer isn't doing anything special in terms of making flu shots available, what's the best way to get a flu shot?
If you have a primary care doctor, they can help you either get the shot in their office, they can refer you to a pharmacy that's easy for you. There's some flu clinics around. Most insurance plans cover flu shots because it's a very effective medicine, so the cost is definitely worth it for them. So touch base with primary care, and or most employee wellness programs usually have a flu program because they want you to be able to work. And we know it keeps people well.
Excellent. And that's, I had not heard your point that a flu getting your immune system going can actually have some positive impacts if you're unlucky enough to get COVID as well. That's fascinating. Thank you, Dr. Leffler, and we will keep pushing that message out. I also think there's some benefit in sort of getting those, getting people thinking about getting a flu vaccine is a good sort of dry run for the COVID vaccine, which we all hope is coming not too far down the pike. Other people voicing some of the optimism you've expressed on this on these briefings in the past. So anything you want to say on that front?
Yeah, so I am confident that we will have at least one, if not more, options for COVID vaccines. I don't think it's likely to be before the new year, but I think sometime in January or February, we will see a vaccine that's available for people who want them. And I know there's a lot of controversy right now about vaccines for COVID, and I think you have to separate them out into different categories. So I think that once we have a vaccine in Vermont or options, I'm happy to come talk to your on this about what vaccines are safe, which ones aren't. We can bring some of my ID docs if you'd like, and really have a good conversation about that. I will say though that even though there's some controversy about COVID, which I think we can talk about, there's not much controversy on the flu vaccine. We know it's safe. We know it's safe for almost every person. So I hate to keep coming back to that same message, but we have something available now that can keep Vermonters well out of our emergency departments, out of our hospital beds, and out of quarantine when it looks like maybe they think they have COVID. So, and I think as we get a vaccine for COVID, it'd be great to come back and talk about the different options and what we know about them.
We will definitely have you back when we get to that exciting day, which it is hopeful to think about that not being so far into the future at this point. When Dr. Leffler says it's time to take the flu vaccine, I'll be headed out to take the COVID vaccine. That's what I'm looking for the sign off. I'm sure many Chittenden County residents agree. So
I'll get it with you, Moreau. We'll do it together.
Excellent. All right. With that, thank you. Thank you for your important message on all three of those fronts. Get outside, get your flu vaccine now. This is the year to do it. If you ever doubted doing it in the past, we need you to do it this year. It's good for you. It's good for everyone. And then finally, stay tuned for news on a COVID vaccine. Thank you. We'll see you again soon, Dr. Leffler.
See you soon.
We're going to shift gears now, and I believe we have, well, bring me up to speed, Olivia. We do. We have Ryan Ferris, I believe, is joining us from Garnet Transport Medicine. Garnet is the company that has just started operations out at the Burlington International Airport. and is offering a range of services at the airport, including, I believe, if I have this is on point with what we just heard from Dr. Leffler. The Garnet is a place that you can get a flu vaccination, I believe, a flu shot. And there are also several different COVID services that Garnet is now offering. This is a new service. I put this in the basket of the city is being interested in anything it can do with any of its resources, assets to help suppress, contain the virus. And we know that the airport is a place where is a potential vector of people bringing the virus into Vermont, and we hope that having this service there has a variety of benefits and will help reduce that risk in some way. So with that, Ryan, welcome. Thank you for joining us.
Thank you very much, Mayor, for having me.
Ryan, you want to kind of summarize how your operation is working right now? How's the start going, and what do you want people to know about who can take advantage of these services, and what are you offering there?
Sure. So just one correction I'd like to make with regard to the flu vaccine is we don't currently offer that there. We are looking at offering that to the general public. We do offer it to our own staff voluntarily, and we just have some more details to work out on logistically and how we compliantly offer the flu vaccine to the general public. But with that being said, we do offer, we actually opened officially today. We have been doing some limited testing there since last week. We do offer a rapid antigen test for COVID, a PCR test that's mailed away to what's called a reference laboratory in Colorado. That's available typically between 36 and 48 hours after collection. And we are offering flu A and flu B tests for those that are symptomatic. And as Dr. Leffler appropriately said, the symptoms for COVID and flu-like illnesses are very similar. And so in addition to the importance of getting a flu shot, testing and screening for flu as well as COVID and like illnesses is going to be important to identifying and targeting community spread if it's there. Our primary sort of objective is generally to make testing more available to anyone who wants it, and that's as an augmented sort of support function for the current and sort of everyday healthcare system, the health department, UVM, the health network, and the community partners that sort of feed into that network. We're just looking to provide access and availability. We'll within the next week or two have 7-day, 12 hours per day availability, which I think is expanded from most primary care practices. We'll have the ability to do a high volume of tests per day, and our self-scheduling and registration process by the end of this week or early next week at the latest will be very user-friendly. And so for the traveling public that are flying in from other higher viral prevalence areas into Vermont, sort of the goal for us is from the time you deplane and get your bag, you should be able to easily schedule a test on your way out. And one other point I just sort of would like to make on the traveling public is those that choose to get a rapid test at the point of entry will also be encouraged to pre-schedule a follow-up PCR to clear their quarantine after 7 days. And we have all the tools and capabilities within our systems to follow up with test participants to ensure that they have every available opportunity to fulfill and satisfy the obligations set forth by the governor's executive orders in the health department.
Great, Ryan. I appreciate you emphasizing that, and I think it is important for people to know if they are considering the service and taking the service. The rapid antigen test does not in and of itself a negative test there does not satisfy the quarantine requirements. But I think that's great that part of the way you are offering this is to get people to schedule right then the follow-up test that is the clearance out of quarantine. Is that the right way? I restated what you said correctly there, right?
Yeah, and I think the objective for us is for screening with rapid as well as follow-up PCR. The example that I use a lot and that I gave this morning during our press conference and Q&A session was that, let's say somebody is traveling for 5 days for business. The current guidelines only allow quarantine clearance testing on or after 7 days. So by the book, that person that's here for 5 days would not be eligible to have an order for a test written for them. There could be some exceptions to that I'm not aware of, but generally speaking, they want you to wait 7 days, which is an appropriate amount of time. And what we think will be a sort of a value add to the community and a good passive surveillance tool will be to make those easily accessible rapid testing options available to catch potentially somebody that may be asymptomatic and positive, but will not be here long enough to be tested by the health department or a primary care provider. The other issue is that, if you're not from here and you're traveling, the likelihood of being able to get in to be seen by a primary care provider is reduced because you're not from this area. So we're sort of filling in the gaps where maybe the system is not equipped or set up to cover, so that we can do absolutely as much as possible to try to identify and contain any spread.
Okay, thank you, Ryan. I just want to clarify though, right? So the way the governor's order works, if you're coming from a quarantine area, if you're coming from a place that requires quarantine upon arrival for business, you are under order from the governor to quarantine from the point you arrive until you've met the rules of the quarantine.
Yes, that is true. The governor's executive orders and the recommendations and requirements from the health department still stand. We don't supersede or take place of any of that. We're simply providing another screening, if you want to call it, but a lot of the times it's peace of mind, and then follow-up and scheduling of PCR tests for those that may not have local providers. So absolutely 100% correct. The executive orders and the health department's regulations still are in effect as they always have been, and our objective is to not supersede that. We're here to enhance compliance with those requirements.
Okay, excellent. And just a couple last things to emphasize. I think you said it, but and it's up there on the screen, but I want to make sure it's clear to people. You don't have to be flying to take advantage of the services being offered by Garnet. Burlingtonians you can schedule an appointment or go. Are there drop-in services available, or is it all scheduled, Ryan?
Yeah, and so yes, it's not sort of walk-up window type service where you don't need an appointment, but it is almost that. So there is still a number of sort of documentation and compliance pieces to providing these types of services safely and effectively according to the health department regulations. So like I said, essentially, and I use the traveler example, getting off a plane, but if you woke up at 8 a.m. and decided, I want a COVID test today, or I need a COVID test today for whatever reason, the objective is, you go to our website, you click on the link, you self-schedule, self-register, answer all the CDC screening questions, attest to your understanding of the health department regulations, and select whichever test you want. I think it's important for us to make sure that people understand, if you choose an antigen test, there is an attestation, so to speak, that you have presented with and understand the requirements, and that you're doing this with informed consent. And we always try to direct people towards the most appropriate testing method. But again, the objective is between 15 and 30 minutes from the time you want to test you can get a test, and the results are available for rapid antigen tests. They're available within the hour, and for PCR tests, they're available between 36 and 48 hours. So relatively quickly, and our objective is to be convenient but also accurate at the same time.
Excellent. That's helpful. And then just finally, I think part of the reason I appreciate you correcting me, so it's not flu shots, but flu testing that is, and actually not a concept I'm totally clear on. Can you just make sure people understand what the flu testing service is?
Yeah, so the flu testing that we do is on the same machine that processes the rapid antigen test. So the flu test, it's a flu A and flu B test. So it's actually two tests that are run on one specimen, and it identifies either the flu A strain or flu B strain. And the idea behind that is if somebody is symptomatic and you do just a COVID test and they come back negative, well, you can fairly confidently with a PCR or antigen test say, well, you probably are there's a very high likelihood that you don't have COVID. But then the ultimate question is, well, I still have flu-like symptoms. I still have a fever. I still have all these other associated signs and symptoms. So what do I have? And the next logical conclusion to be drawn there is flu. So instead of having that person come back after a negative result and retest for flu, if they fit the criteria, we're just going to test them for all possible flu and COVID. So I think that's a screening tool, but it's also peace of mind, and it's also giving people answers in a time when I think people really want reliable and quick answers, so that they can make life decisions and decide what they're going to do. Or there's a lot of social psychological issues that go along with knowing or not knowing.
Wow. All right. That's great. It's a really interesting complimentary service to the COVID testing. That's great. Ryan, we really appreciate you joining us today. We're appreciative of the work out at the airport and this new service. Thanks for joining us to share a little more about it.
Great. Thank you.
Take care. Good luck. All right. We want to talk kind of shifting away from the public health focus on COVID. This is still a kind of COVID related topic in that voting this fall is different, like everything else. And it's important now that we are just under 3 weeks out. You really want to make sure everyone's clear on all the details of voting this year. And we are joined by Amy Bovey from the Clerk Treasurer's Office. Amy really runs our elections, has done so for years, has really brought just a great attention to detail and leadership to this position, and has, knock on wood, just has very smoothly administered many elections now, including this unprecedented election we just had in August, where we had the most absentee ballots for a primary, the most votes for a primary that I believe we've ever seen. And my understanding is we have already exceeded, as of yesterday, as a state at least, I don't know about in Burlington, the number of total absentee ballots received for a general election, and that is with 3 weeks to go. So this is a really unique election. Amy, thank you for joining us, and looking forward to hearing. Please share with our viewers everything they need to know for this key election.
Yeah, absolutely. Thank you for having me. So one significant change that the state has made this year, as most folks have probably heard by now, the state decided to automatically mail all active registered voters absentee ballots. Burlington's ballots went out on September 22nd, and many of you have received and voted those ballots already. But do want to let folks know that if you've not yet received a ballot, please get in touch with our office. We can help figure out what's happened with that and make sure it does arrive in time for you to vote before November 3rd. If you haven't yet registered to vote, there's still plenty of time to do that. The easiest way to do that is to go online. Looks like there's a link here in the slides. It's olvr.vermont.gov. That can be done through close of business at 1 p.m. on November 2nd, and then in person at the polls on election day. As soon as we do process your voter registration, we will automatically issue you a ballot as well. So once you've had your ballot,
Let's just pause on that for a second. First, that's awesome that people can register right up to election day. Great which is a relatively recent phenomenon, right? How many years have we, not just a couple years or so, that we've had this same day registration? Amy, how long have we had?
it started in 2018, 17 or 18.
It wasn't that long ago that there was a real, well, we don't have to recreate history, but that was a big step. That's really important for everyone here, that the same day registration rules that have become the norm here in Vermont remain in effect. And those are the two ways to do it. There's the online version up until 1 p.m. November 2nd, which is the day before, right? That's the Monday. What is the second? The Monday before election day. And then if you miss that deadline and still want to register, you go in person, and there'll be a table there. You'll be able to immediately become a Burlington voter.
Yes, exactly.
Okay, great. All right. So once you are registered to vote, there are a lot of options this year for voting. And are we going to, you want to walk us through each of the options?
Yeah, I'd be happy to. So once you receive your ballot, the number one key is to very carefully be sure that you follow the instructions as you're filling it out. Remember that the ballot needs to be enclosed inside the certificate envelope, we call it. That's the envelope with your name on it. And that envelope also needs to be signed. It's super important that everyone pay attention to those details. Those are kind of the two requirements for your vote to count. If you miss those steps and it's turned into our office, unfortunately, the ballot doesn't count in Vermont. A law does not allow you to correct that error. So just be super attentive to those two details.
I mean, that's a real issue, right? There's a real concern that there's that is not an uncommon mistake for people to make, right? To fail to sign it.
It did seem to happen quite a bit in the August primary. We saw much higher numbers than we'd like to see and would normally see, I think in part because it was new for a lot of folks. So far, our numbers for November are looking much better. It looks like it's only about 1% of voters so far who have made those mistakes. So certainly lower than what we saw in the primary, but ideally we'd like that number to be 0. So just reminding folks to carefully pay attention to those instructions.
Great. Okay. Since I got you here, Amy, I had a constituent ask just the other day. They got worried that they had forgotten to sign their ballot, so they had already sealed it in the privacy envelope. And then, so what they ended up doing is opening up the envelope to check. They actually had signed it, but then they were worried that just taping it closed or something would be a problem. Can you, in that scenario, do you have to worry about the kind of integrity of the envelope around the ballot?
As long as the ballot itself is enclosed in the signed envelope, how you return it, that mailing envelope is not required. It can be taped shut, it can be licked shut, it doesn't even have to be sealed at all if you want to hand it to a person. So really the key is just signing the certificate envelope and making sure your ballot is enclosed inside of it.
All right, excellent. So once you follow those directions, then what do you do?
So then there are a large number of options that we've set up for you to return those ballots. First is the obvious, mailing your ballot. We've heard a lot of media reports about fears and concerns around the post office, but do just want to share, that's certainly the most common method that voters are using. We're successfully receiving hundreds, if not thousands of ballots every day in the mail. Seems like Burlington mail on average is still only taking about 2 days to go from one Burlington address to another. So you just want to reassure folks that is still a good option for you. And we are encouraging everyone, just out of an abundance of caution, to mail your ballot no later than October 27th to ensure that does reach us in time. We do have to physically have it by election day in order for it to count. Some folks are telling us they feel more comfortable, leaving the post office out of it, hand delivering it. We've got a number of ballot drop boxes set up around the city. We have 3 outdoor drop boxes that are available 24/7. They're emptied daily. Those ballots are, brought into the building, processed. The 3 locations are City Hall. That box is on the sidewalk on the Main Street side of the building across from the Flynn Theater. We've got one in front of the building at the Department of Public Works, 645 Pine Street. And we've also got one at Fire Station number 2, 132 North Avenue. That box is located around the back of the building. Those 3 outdoor drop boxes are all wrapped in the Burlington flag. I think they're pretty easy to spot, and you can just place your ballot in there. Beginning next week, we will also have an option for New North End residents to drop their ballots just inside the building at the Miller Center. That will be available Monday through Friday, 9 to 3 p.m., 9 a.m. to 3 p.m. So that will begin next Monday. Additionally, we have drop-off options indoors at City Hall Monday through Friday, 8 to 4:30 during our business hours. So we'd certainly encourage folks to, utilize one of these non-contact options, get your ballot into us early, but the polling places will still be set up and available on election day. If you've got your completed voted ballot, you can simply hand it to, we're calling them kind of greeters that will be stationed at the door. They can collect your ballot and bring it in to be counted. If you do prefer to cast your vote in person, that's also an option. We'd encourage you to bring your ballot with you, check in as usual, and you'll be allowed to vote that ballot. If you do lose or forget your ballot, there is just an affidavit you'll need to sign stating that you haven't already voted, and you'll be allowed to vote in person after completing those steps. And of course, we'll have COVID protocols set up at the polls just to keep everybody as safe as possible. That should be very similar to what we saw in the August primary with, some adjustments to our setup, capacity limits, one-way traffic flow. Masks will be required, of course, so make sure you wear your mask. So all of that will be set up and available to make it safe for those who do choose to vote in person. Great. And a few other items on the slide that are just interesting for folks to know. If you're dropped your ballot off, mailed it in, you want to just make sure that we've got it. You can check to see the status on your My Voter page. You can log into your voter page at mvp.vermont.gov. And we've already received, actually after today's mail, the number is closer to 8,000 ballots already, which is about 1/3 of all ballots that are out there. So it's great to see such strong numbers, and definitely encourage folks to keep sending them back into us.
That's great, Amy. So that's 1/3 of all the ballots that were sent out have come back, and how does that compare to a normal presidential year? The total number of people voting, I think our high has been around 18,000, is that right? Or in that ballpark?
Yeah, 18 to 19,000 seems to be normal. And yes, we've received about 8,000 already. So, we're, I think, on track to have record-breaking turnout if, the numbers continue at the rate they've been so far.
Excellent. Great. And then I think it's so interesting that there is that service that you can go online and confirm that your ballot has arrived. I think that, especially with all the talk about the reliability or not of the United States Postal Service, to have that, I think that's something, if people do mail it in, they might want to check. Although, again, every indication is that the local postal service, is running, and you said 2 days is the average transmission time.
For the most part, yes.
How, for people, what exactly happens? So you, by mail or one of these drop-off auctions, you get the ballot in the clerk's office, and then you compare that ballot. You know who it came from, and you compare it to the voter checklist, and you actually check off electronically somehow that ballot has been received, and so there's a fail-safe. If somehow something happens, unexpected happens to the ballot, it doesn't arrive, people can still show up on election day, and the record will show that you haven't voted yet, and you'll be issued a new ballot. Is that right?
Exactly. Yes, we carefully track the names of the voters. Every ballot we receive back, we mark that we've received that ballot in our system. So when we generate the checklists for use on election day, it'll be marked as that person having already voted. Had we not received a ballot back, there'd be an indication on the checklist that a ballot had been sent but not yet received. That voter could again sign an affidavit saying they haven't already voted and be issued a new ballot.
All right, excellent. Amy, thank you for joining us, and moreover, thank you for your incredibly hard work. I mean, I think people don't, everything we've been describing here, so much of it is sort of new and has had to be put in place to make this election work. Thank you for the major effort to get these drop-off boxes. I know that we see in the headlines that there's like we're talking about one drop-off boxes for whole counties or something down in Texas. It's great we were able to get 3 of them and get them set up and operational, and appreciate how hard you and your team are working on this.
Thank you.
All right, I think we have one last quick item, and this is sort of a follow-up to the conversation we had with Dr. Leffler. We're going to try to make this a kind of recurring item on these briefings. We are going to focus on a different outdoor activity each week and really try to get the word out about these opportunities. And this week we, as I sort of referenced earlier, we are thinking about City Hall Park and the official opening, which is taking place on 2 days, Friday and Saturday. And there's a whole, a lot, we've had a team putting together 2 days of programming, local music. There are a variety, I think that we have 4 different tours of the park that are focused on various elements of what has been created over the last year plus of construction. I think there's a tour on the public art. There's a tour on the stormwater elements, and there's another one on just the design issues. So check those out. More details on the website. There's also some arts activities. There's some movie. And as we heard from Dr. Leffler, this should be a safe activity for people to do. People should wear masks. They should be aware of their distance to others and not, and keep, some distance. If you're going to be interacting with someone for a sustained period of time, you want to try to, not be right next to them. But this is something that we encourage people to consider coming out, and it is an exciting day for the city. This is a project, a decade in the making. In some ways goes back much longer than that. We'll have more to say about the significance of the new park and the details behind its design. That'll be the focus of Friday. But for now, I just want to say, check out the website, burlingtoncityarts.org, for all the details on the 2 days of programming. And I'm going to be spending a good chunk of those days down at the park, and I hope to see you there. With that, let's open up if there are any questions. Olivia, I'm happy to answer some questions. I think Ryan from Garnet is also still with us. And I think Amy may still be with us too. So let us know if there are any questions.
Great. So a reminder for members of the media who are joining us, please just email me to let me know you have a question, and I will get you into the queue. Our first question is from Jolie Sherman. Jolie, you should be able to enable your microphone.
Hi, can you hear me okay?
Yes, go ahead, Jolie.
Hi, Mayor Weinberger. Thank you so much. I wanted to know kind of your reaction to an opportunity like this related to the testing site at the Burlington International Airport. The fact that the city is offering something like this, what's your reaction to that?
Well, Julie, the city's posture since March has been that local actions matter in a global pandemic. We know that. We figured that. We did some early work way back in February, realized that cities that were focused on public health during the pandemic 100 years ago did much better than those that were slow or complacent in their response. And we, in every way that we can think of, have tried to act as a city. We've really repurposed much of city government to try to put us on a footing of containing the virus as much as possible. So, everything from very early on, actually fabricating masks for our essential workers, and then for the really over 20,000 masks for the Burlington public, to recent steps like limiting bar hours and limiting group gathering size. We basically, it has been our belief that we can save lives, and really the quickest route to economic recovery was through boxing in the virus and containing it to the greatest degree possible. So we're always looking for ways, as we've learned more about the virus and more innovations come forward. We want to be right there on the cutting edge of those innovations. That's how we've gotten to this posture we talked about last week with wastewater testing, and having services at the airport. I would put in that same category. This is looking around the country. More and more airports are offering some level of testing services, and I'm glad that we have this additional service to be able to offer, or for a partner to offer, at the Burlington International Airport. It's important that people understand the rules. It's important that people understand that the rapid testing is not a get out of quarantine free card. It is critical that people continue to follow the governor's orders and be aware of those orders. But it certainly seems to me, knowing that the airport, where we do have, even at our reduced levels of travel, we have thousands of people coming through the airport on a regular basis. They're coming to Burlington in many cases. Many people getting off the plane are coming from places where there's a much higher prevalence of the virus than there is here in Chittenden County. We would hate to see the airport become a significant vector for virus transmission here in Chittenden County. And so I think having this service, having this additional layer of screening and testing is, it's not a panacea. It's not perfect, but it is, there isn't anything until we have a vaccine. There isn't really any perfect intervention. The whole philosophy is to layer more and more protections on top of each other, to bring down, the potential for harm, to reduce the level of harm. And this is another one of those services and strategies that I think achieves that.
Thank you so much.
Great, thank you.
Next question is from Grace Ellison. Grace, you should be able to enable your microphone.
Hi, can you hear me?
We can, Grace, go ahead.
Yeah, Mayor Weinberger, this question may be posed to you or to Ryan with Garnett, but I have a question about how the partnership is working. Is the city renting the space in the airport to Garnett? Is Garnett being paid to set up in this airport to do the testing? And do travelers or residents have to pay for the testing?
Great, yeah, I will, Ryan, if you're still here, if you could address those questions, that'd be great. This was all memorialized in an agreement that was approved by the City Council and Board of Finance a couple weeks ago. But if you could address all of Grace's questions, that'd be great.
Sure. So to your first point, this is, our relationship and our, as the mayor said, contractual agreement with the city is the same that it would be for any vendor at the airport. And that structure is either based on, a revenue, like for Skinny Pancake, I believe it's based off of a percentage of their revenues. There's an agreed upon amount. We pay, in lieu of rent, we pay a fixed price per patient that comes through. So it's commensurate with the volume that we see and the amount of service that we're providing to the city and those that are traveling through the airport. And I'm sorry, what was the other part of your question?
Do travelers or residents have to pay for the testing?
Sure. So, I think it's important to understand that, at some point, whether you get a test from the health department or whether you get a test from UVM or your primary care provider or anyone, somebody has to foot the bill for the materials and the skilled labor that goes into collecting that. So what I will say is that we do accept insurance. That'll start, I believe, within the next week or two. There's a long, drawn-out process for provider enrollment to be able to bill insurance. And so currently, this is a voluntary out-of-pocket expense. However, we will provide either invoices or claims to people that are choosing to participate in the testing for which they can submit to their insurance for reimbursement. So the answer is you shouldn't have to. You shouldn't incur any expense at the end of it. It's currently just a paperwork issue, unless you choose to pay out of pocket and not not use your insurance. We do accept FSA and HSA account cards as well. But we're not allowed to balance bill people for unreimbursed services from insurance companies. We don't do that. So if we do bill insurance, we basically take what they send back to us. So the roundabout answer to your question is no, this should not cost anybody out of pocket unless they choose to go that route.
Gotcha. And do you have an amount of how much the antigen test versus the PCR test costs?
That is, it's not a direct straight line answer. So it depends on who we're billing for the services. But just to give you an example, I mentioned this at the press conference this morning. Let's say you decided you didn't want to use your insurance for whatever reason. An antigen test is anywhere between $125 and $150, and a PCR test is $175. And there's different pricing if you combine those together. If you also get flu, so it's from our market research, it's priced very reasonably within the market compared to what you would pay as a cash price if you went to your primary care or any other place like a Quest or LabCorp.
Gotcha. And do you have any projections on how many tests you anticipate to do in the coming weeks when you get up and running?
Well, before making the announcement, we've been doing anywhere between 15 and 20, sometimes up to 25 tests per day, and that's spread out between our that location as of last week and our mobile collection offering for people that can't leave the house or shouldn't leave the house to go get tested. So I expect that to get that location to get quite busy now that we're sort of public facing and available in the airport. But it would be inaccurate for me to project right now, just based on the exposure.
Gotcha. And where are you located in the airport specifically?
Yep. So we're in an isolated building next to the cell phone lot, which is, I believe, 481 White Street. And we are the only people that occupy the building. And the testing is all done through, basically a window system.
People may know the location, Grace. If it's where there used to be some years ago, there was sort of a parking lot and some services.
It's a park and fly building.
Yeah, it was like a park and ride, and you could get your car cleaned while you were on a trip. That service was discontinued some years ago. So it's just if you come into the airport entrance, basically from the southeast, if you were to drive, kind of past the main terminal, it would be very quickly on your right once you get past the terminal.
Gotcha. Thank you.
Thank you. Is
And
that?
it looks like that's all the questions we have for today.
All right, great. Thank you for joining us, everyone. Thank you again, Ryan and Amy and Dr. Leffler. And we'll see you all again soon. Take care.